So, surgical services is the financial engine of a health system. It generates over 65% of the hospital margin, typically for high performing surgical services. And so, it's instrumental in delivering sustainable care. And we, as a company, Surgical Directions, are brought in to help with areas across procedural care. And we're brought in for various reasons, right? Various sort of tactical reasons, whether it's an issue with surgeon access, an issue with anesthesia. But what we found is really what underlies each of these issues is a cultural problem. And the ability for people to effectively communicate and collaborate across the numerous stakeholders in surgery leads to these downstream tactical problems. And so, what we do as an organization is we fix the tactical issues, but through that process, we design a much more collaborative and communicative culture because it's the culture that causes those friction points. Surgical Directions has worked across about 500 different healthcare and procedural care facilities, and we've really bubbled it up to four key drivers. The first one is having an effective governance and a physician-led governance structure that's administratively sponsored. The second one is having a fair and transparent surgeon access system where surgeons can see the patients when they need to see them, where they need to see them, that aligns to what the health system's goals are as to when, where, and what cases to do in each location. The third is overall efficiency, right? Your OR is one of the most expensive assets within a hospital system, and the cost per minute can be prohibitive in terms of sustainable financial performance if you're not making the most of each of those minutes. So how are you making sure that you're limiting what we call white space in your schedule so that you're maximizing your resources, your very expensive resources within the prime time working hours? And lastly, is making sure that you have those digital solutions, right? While someone is redesigning the processes, making sure that you have the right people in leadership, you also have to think about technology. And it's helpful to think about all three, people, process, and technology, together at the same time so that you're not introducing a technology after you've already redesigned a process, or you maybe don't have the right people to really do that process. But so using all three together with that technology, with that end in mind, is very helpful in transforming and improving the performance of your procedural care.